Assalamu alaikum. Welcome to today's Cataract Surgery Insight. I'm Dr. Abdurrahman Muhammad Alam, going to perform this cataract surgery in this NS1 cataract with in- increased lenticular pressure. It seems like a white cataract, white intumescent cataract. I've already stained the anterior capsule with Durex and made the side port and main port. Now I filled the anterior chamber with OVD and started with the creation of the capsulorhexis. I felt that the anterior capsule was running to the periphery, so I re-injected OVD to pressurize the anterior chamber in order to flatten the anterior capsule so that it does not radialize. Intermittently, I am injecting OVD again to form the AC again. See the liquefied cortex underneath the swollen cortex underneath the rhexis flap. I've completed a beautiful circular 5.5 millimeter continuous curvilinear capsulorhexis. Now I'm performing hydrodissection and tapping the nucleus to have a good cortical cleavage. Now also I've performed hydrodelineation. Now with the help of the phaco handpiece, I'll perform direct vertical chop. Before that, I am clearing off the superficial cortex and epinucleus in pre-phaco mode. Since I rotated the nucleus, now see the golden ring that indicates the boundary of the endonucleus. Now I reduce the longitudinal power to 35 and I'm going to perform the direct vertical chop. Now chop this piece into further 3 pieces. This heminucleus was sub-chopped into further 3 pieces. Now I'm performing quadrant removal. Now this heminucleus can be chopped into 2 pieces and emulsified in quadrant mode. Now in epinucleus mode, try to emulsify the epinucleus shell. With help of the epinucleus mode, I was able to fully remove the epinucleus shell that was remaining. Now refill the anterior chamber with OVD and perform cortical removal with bimanual IA handpiece. All the cortical matter has been successfully removed. Now perform little bit of polishing of the anterior capsular rim. Now refill the anterior chamber with OVD. Enlarge the main port incision to 2.8 mm and implant the IOL into the posterior capsular bag. Now only remaining part is removal of the OVD that was injected into the eye in viscous setting where there is high vacuum, high aspiration and high bottle height. Go behind the IOL and remove the OVD that is trapped behind the IOL. A thorough removal of the OVD ensures that there is no postoperative IOP spike in the following postoperative days. Now all the visco has been removed from the anterior chamber. Now we press the side port with the aspiration handpiece and remove the irrigation ions. Now perform stromal hydration of the side port and main port and inject intracameral antibiotic and subconjunctival dexamethasone, and the case is completed. Thank you, my dear friends, for being with me in this surgical video. Hope it was very helpful in developing your surgical skills.